So we're doing today a correction of a spinal deformity in a child. She's 16 years old, but she's only 20 kilos. At this point, the deformity is so bad that she lost the ability to sit in the wheelchair. Her pelvis, what she sits on, is so deformed that she's sitting only on one side, and then she's been moved from a wheelchair to a bed. So instead of going around in a wheelchair from a place to a place, she lost that ability. She's stuck at home in a bed for the entire time. And the reason why we're operating on her today is to try to give her back the ability to sit and to enjoy life through a wheelchair. We're going to be using the Mazor robot for the pelvic fixation, and we're going to be using optic navigation in order to follow the chest as the chest is moving to make sure that the pedicle screws that we're placing in the spine are going to be accurate. We're going to be using special glasses that will allow us to see everything in real time as we're doing it, so we won't need to be looking at screens, and we'll be able to be focused on the deformity. And a combination between the optic navigation and the hollow lenses, or the lenses that allow us to actually see what we're doing in front of our eyes, really makes our work as surgeons much easier and much safer for the children. We're used to looking at screens all around the room. When we're looking at the things in front of our eyes, we do not need to start looking around. We can stay focused on the patients. And the combination between these technologies has reached a point where it's actually convenient and comfortable. And whenever it's good for the surgeon, it's good for the patient. We're the first hospital doing these combinations. We've been using it for the last several months. We specialize in difficult cases and we get referrals. And I'd say that almost every week now, we bring on one of these really challenging cases into the hospital. And thank God we've been able to let these kids enjoy a much better quality of life afterwards. We've had patients from the United States come to Hadassah. We've had patients coming from Russia. We have patients coming in from Arab countries to have surgery by us. We try to do a good job for anyone who comes to our doorsteps. We're pushing the limit in adults, we're pushing the limits in children. We're trying to bring the advantages of modern medicine and advanced technology to the benefits of patients that 10 or 15 years ago we had nothing to do for them.